Links procedure, for example, this is something that's interesting. It's a perfect example of how we use new technologies and adapt and fix them. For example, the Links device, a new technology that's been out for the last, I would say, maybe 2 or 3, maybe 4 years to treat severe acid reflux. Prior to this technology, patients with acid reflux had no options but either get medications for the rest of their lives with the side effects of medication or get an operation called a Nissen fundoplication. Nissen fundoplication had to be done by a surgeon who knows how to do this operation the right way, because the side effects of not doing the operation appropriately led to patients sometimes in some conditions being worse off than prior to their acid reflux days. Medical professionals and sometimes gastroenterologists were hesitant referring their patients with a severe acid reflux to surgeons because of the fear of the side effects and complications of something called a Nissen fundoplication. Links device is basically a device that's used to treat acid reflux. It's like a valve that's placed on the lower esophagus, prevents the acid from going back up in the stomach, cures the disease, helps the patient. Great. That's technology. We advanced that technology. We used this technology to our advancements. We used this technology to treat acid reflux, but we adapted to it and improved it. In the beginning, the device size, for example, was different. They were different sizes, and some of the sizes were either too loose or too tight. Combining advanced imaging and evaluation of pressures within the esophagus and within the diaphragm using another technology called EndoFlip, which again is brand new. Most physicians don't even know it exists, allowed us to use this to size the Links device and place them in a more favorable location around the esophagus, around the lower esophageal sphincter, decreasing the complications and the side effects, improving the quality, treating a very difficult disease to live with that really has no treatment except long life medications. Again, surgery can cure diseases that have really no cure but medicine for the rest of your life. Ties along with how, hypertension, when you take medications for blood pressure, you're not curing the disease, you're just masking the symptoms for the rest of your life. When you take medications for diabetes, you're not curing the disease, you're just masking the symptoms for the rest of your life. These surgical procedures actually cure the disease, cure the root cause of the problem, and correct it, and stops the medications and gives patients better quality of life.
And we can take that technology like the Links and we can say, how can we use it to help different populations where, you mentioned the Nissen fundoplication, but in some of our bariatric patients, that may not be an option for them because of their previous surgery. So we can take this technology and how can we help our patients, whether it be bariatric or other patients, to treat their severe reflux that's refractory to medication. And in fact, with Dr. Sadek, where our practice is part of a large multi-center trial looking into how can we use the Links technology in bariatric patients to treat acid reflux.